open letter to the government of Canada and the Prime Minister of Canada, talking about the fact that while we are doing a good job as a country, there still needs to be some future investment, so-called future proofing, if you will, relative to rapid testing, as well as support for the pharmaceutical industry to support vaccine development in our own environment here in Canada. That certainly is a topic that's on the minds of many Canadians and many people who have joined us here today. While we will get into the conversation a little bit about what that means, what future proofing looks like, how we can advance and grow our capacity as a country. Dr. Bogoch, I wanted to start specifically with you because for many, there's still a tremendous amount of confusion. And that's our first question for the day is, how do we manage that, that huge amount of communication that has to go on in our environment? And what does it mean for people to truly understand the processes in every province? And so this is a multi-parted question, quite frankly. And what does it mean when we take a look at 4 or 5, 6 months down the road? Is there really a light at the end of this tunnel?
Okay, great questions. And let me just tackle this in a few different parts. Yes, there is tremendous amount of confusion around when people will get vaccinated. Why is that the case? Because you're seeing different provinces take slightly different approaches, but they're similar, but healthcare at the end of the day is provincially run and the provinces are taking slightly different approaches. In addition to that, depending on which province you're in, you might have varying degrees of clarity from your senior political and public health leadership as to how the vaccine program is going to be rolling out. Also, we're very tuned into our national and international media. You're watching vaccine programs speed along in Israel, the UK, the United States. You're watching them slowly trudge along here in Canada. You're watching different provinces do slightly different things at different rates. So it can be confusing. My advice is look locally. Look locally, watch your local news, listen to your local public health leadership, because that's what's going to be the most impactful and relevant to you. And just because, Alberta started signing people 75 years and up the other day, it doesn't mean that Saskatchewan is doing the exact same thing. Decisions are made. I can speak from an Ontario standpoint, but I know that there's more similarities than differences across the country. How are decisions being made about who should be vaccinated and when? You look at this through a lens of equity, you look at this through a lens of evidence, and you look at it through a lens of operationalization. And the sweet spot, that Venn diagram of equity, evidence, and operationalization really lands somewhere in the middle. And that's why you're probably, I know it looks funny right now, but at the end of the day, you're probably going to see more similarities than differences between the vaccine programs. Yes, different provinces have different leadership and different sign-up programs and all that, but there's probably more similarities than differences at the end of the day. It's easy to say, oh, they're doing this now and we're waiting 2 weeks and they started a week from now and they're doing 80 years old and they're doing 75 years old. Again, when you look under the hood, there's probably going to be more similarities than differences. And how do you navigate the uncertainty? That's tough, but there really is a light at the end of the tunnel. We may have a third wave. We may have a third wavelet, like a little small wave. It's unclear. It's unclear. We don't know, but we definitely know that throughout 2020, whether we have a wave or a wavelet or whatever happens over the next couple of weeks, we certainly know that as 2020 moves on, as we move from spring to summer and beyond, more and more and more of us are going to be vaccinated. We're going to see things at least gradually return toward life as we remember pre-COVID-19, gradual lifting of public health measures, more and more people allowed indoors, more and more people allowed outdoors. Maybe mask mandates will be lifted at some point, softening of the border. Like, things are truly going to get better and better and better. We're just in this bizarre transitionary period where very few of us are vaccinated to when most of us get vaccinated.
So we can see in the chat, there are lots of questions coming in with specificity around people with disabilities, people with, or children, I know, Goldy, these are questions that you get on a regular basis, not from a clinical perspective, but really from an organizational perspective, or from your advocacy work that you do with government around businesses working to try and help. So what we can't give definitive answers, obviously, to people here, although as much as we would like to, we can't do that. But Isaac, your point about listening locally and the communications that are happening locally. But Goldy, what's your perspective on all of this?
Well, first of all, Leslie, thanks for having me here, and I'm really delighted to be here with my friend Isaac. And I think the fact that you've got the two of us is really a reminder of what this crisis is all about. There's been a health emergency, and there has been an economic emergency, and we can't lose sight of the fact that in many ways both are having consequences as the longer we wait to get back to normal. Now, I totally agree, and who am I to disagree with Isaac on this? Absolutely, there's light at the end of this tunnel. But we're at a very critical stage here, right? There's a high degree of anxiety and frustration, partly driven by all the rankings every day. Where are we? You know, and I agree with Isaac. Don't pay attention to that bouncing ball at all. It's silly to compare ourselves to a country like Israel that's 9 million people, that has 1 in 2 people in the family in the military. They do logistics in their sleep. They're used to managing crises. We're not Israel, right? They have a unitary healthcare system. There's lots of reasons we should not panic. Many of those countries are using the Russian vaccine or the Chinese vaccine. We've only got the 2 that we've got now. So I think we should not stress too much about that. I think overall, at the end of the day, what we need to remember is sometime in 2021, we're going to achieve herd immunity. We're all going to get our vaccines, those of us who want them. And, you know, all indications are that many Canadians, as high as 75 to 80% of Canadians indicate that they're going to get it, which is very important that happened. And so I think it's important that we not lose sight of that there's hope on the horizon, that 2021 is going to be a better year. It's certainly going to end a lot better than the last one did, whether there's a third wave or a wavelet. I'm not sure at the end of the day, when all is said and done, we're not going to be able to look at 2021 and say, boy, thank God it's better than it was in 2020. Now, I think we should also recognize that governments, this is an unprecedented event for them. Sure, it happened 100 years ago, but they weren't there. And now to have to deal with this here in a country like Canada, and I think a lot of what we're learning here is it's hard to govern Canada. We're not an easy place to govern. We're seeing it play out on a regular basis with, sort of 13 jurisdictions and different rules and different policies and different directions. And I know that for many Canadians, that has been the source of confusion and concern, and frankly, eroding confidence, because too many people who are experts are saying too many different things. And it's caused, I think, a lot of frustrations on the part of Canadians. And so I think taking stock of how we got here is really important so that we learn for the next time. And I think on issues like masks and school closures and what's in essential services, we've got to do better in having some consistency as to what it means to be in Canada in a health emergency and how it's going to be responded to. Having said that, we should applaud the fact that our governments moved pretty quickly to make sure that the economic foundation was in place for the collapse of the life of, in many cases, the individual or the family. We've, for the most part, preserved social, cohesion. There hasn't been strife. Although I will say I'm quite concerned by racism on the rise, anti-Asian racism stuff, something I had not paid that much attention to until it's brought to my attention. So we're not doing perfect. There's things we need to do better, but I'm optimistic about how the year ends versus how it started.
Thanks, Goldy. One of the things you mentioned in your answer there was really with respect to vaccines. We have 2 approved for use in Canada, with Johnson & Johnson very close in the mix, and AstraZeneca not too far behind, at least in the Health Canada approval processes. But one of the questions that we've seen from our subscribers at MedicAlert, as well as people who have joined us here today, is really about the safety and efficacy of the vaccines. It has been unprecedented, to say the least, the speed at which vaccines have become available. Most of us who've been around healthcare for a while recognize that as typically a 10 to 20 year journey. And we've managed to be able to affect this in 12 months by changing processes and working collaboratively. So Isaac, when people approach you and ask you about efficacy of the vaccines that we have available, or the ones that will likely come to market sooner rather than later, what can you do to reassure individuals that the vaccines are safe?
Yeah, so let's split this up into safety and efficacy, and let's start with the safety. Safety is obviously extremely important. If you're going to release something in the general public and have encourage the vast majority of your population to get it, you better be sure it's as safe as possible. So there is a process. There is a standardized process. This is how drugs and vaccines come to market. First, there's something called preclinical studies. That means it's studied in non-humans, usually in a laboratory setting on non-human animals. Then it reaches human clinical studies, and there's 3 parts: phase 1, phase 2, and phase 3. Phase 1, you check for safety, and you also look for the right dose. Phase 2, a bit bigger than phase 1, you check for safety, and you look to make sure that you're in a vaccine study, your immune system's doing what it's supposed to be doing. Phase 3, you look for safety, and then you also look to see if it actually works in much, much, much larger groups of people who have been exposed to the vaccine. You notice in each one of those phases, you hear safety, safety, safety. That is an integral component to that. And when you look at phase 3 clinical trials, like we look at the 2 that we have, Moderna, 30,000 people in a phase 3 clinical trial. Pfizer, 43,000 people enrolled in a phase 3 clinical trial. You have given a lot of vaccines out to a lot of people, and you can have a much better understanding about what are the common and even some of the less common side effects of these vaccines. It doesn't stop there. Then it has to, all this data has to go to an independent regulatory body. That's Health Canada here at home. That's the FDA in the United States. And they evaluate all the data, the safety, the efficacy data, the manufacturing data. They evaluate all that data, and they give it the thumbs up or the thumbs down. And they have to do this in an independent manner. There can't be any political pressure to speed things along. And you know, that's the reasonable thing to do. That's how drugs and vaccines come to market. And that's exactly what happened with this. No corners cut, took the time to do it. And you know, people say, well, why was it so fast? The answer is a fewfold. One is we know how to make vaccines. So number 2 is there were mRNA vaccines that were being used, which it can speed this process along. And there was a lot of heavy lifting done before COVID came along, really setting the stage for developing rapid mRNA vaccines. The third thing is it's incredible what you can do when you actually prioritize science and really provide an infinite amount of resources. It was basically like, hey, what do you need? You can have it. Just fix this problem, and lo and behold, you can do it rather quickly when you have an infinite amount of resources at your disposal. But like, no corners were cut. Last point on the safety issue, it doesn't even stop there. You've got your phase 1, phase 2, phase 3 clinical trial, independent regulatory body looking at it. Then vaccines are rolled out into the community. Guess what? You still study it. You still evaluate it. Sometimes it's called the phase 4 clinical trial, but basically there's formal mechanisms to look for safety issues that may arise when you're giving this to a much larger population beyond, you know, tens and tens of thousands of people in your clinical trial. So do things come up after vaccines or drugs are released? Yeah, you might hear about it when millions and millions of people have gotten a vaccine rather than, you know, tens and tens of thousands. But, you know, in general, this is the process. There's no corners cut, and I don't think I know it's a good process, but this is the process we use. In terms of efficacy, I'll be a little more brief on this. They work really well. All of the vaccines work. They work to different extents, but they all work. They all do 3 things. Number 1, they reduce your risk of getting the infection. Number 2, if you're unlucky enough to get the infection when you've been vaccinated, they reduce the likelihood of you getting really, really sick, going to hospital, and dying. So they reduce severe infection if you're unlucky enough to get infected. And number 3, they likely, keyword likely, reduce your risk if you are infected of transmitting the virus to other people. So they're really, really good. And I would encourage people to get the vaccine when your turn comes up because they're safe, they're effective. It'll help at an individual level. It'll help at a population level as well.
So thanks, Isaac. There are a lot of questions coming in around people who are very focused on individual condition types, people who are immunosuppressed, individuals with type 1 diabetes, etc. So can we say, you talked about the concept of a phase 4 clinical trial. Are these the populations that are now getting studied as the vaccine is now on mass global rollout? Are those the kinds of things that scientists are now looking at? And when can we begin, what's realistic to begin to see where the answers will come from a timing perspective?
Right, so a couple of things. One is that there have now been tens and tens and tens of millions of vaccines administered. globally, a ton of them in the United States. And the US is vaccinating about 2 million people per day. The UK is vaccinated, I think it's getting close to about 25% of the country. US, about 10 to 12% of the country. Like, there's a lot of people vaccinated. So there's a growing global experience of these vaccines. The other point too is that in the clinical trials, no, they did exclude people with major immunocompromising conditions. So you can't look anyone in the eye and tell them with a straight face how people fared in those clinical trials. However, most I can't say all, but most healthcare providers would say, if you have a compromised immune system, for starters, you're at much greater risk of getting this infection and having a severe outcome if you get this infection. But number two is it's not that I'm talking about Pfizer and Moderna. These are not live vaccines. This is an mRNA vaccine. They're not live vaccines. You cannot get this infection from the vaccine. Many healthcare providers, I'm not saying all, but many or most healthcare providers who care for people with compromised immune systems are very eager to have their patient population vaccinated and are strongly advocating for it. Why? Because those individuals are at risk of having a severe infection and if they were to be infected. And because the vaccine, it's not a concern about risk from the vaccine. It just means that by virtue of being immunocompromised, you probably aren't going to mount the same response to the vaccine compared to those who are not immunocompromised. So you have some protection, but not the same degree of protection. Guess what? Some protection against a potentially lethal infection is fantastic, and it's a lot better than zero protection. And most physicians who care for immunocompromised populations know this and are strongly advocating for their patients to get the vaccine when it comes their turn. Last point, there's no cookie cutter medicine. There's no one size fits all. And really every situation is unique. So this is something where you've got to, at the end of the day, you got to chat with your healthcare provider, either your primary care provider or your specialist who's looking after you, to really discuss what is right in your situation. Last point, I know I'm blabbing on and on and on, but the last point here is that people say, well, when am I going to be prioritized? And the answer is, it depends on where you are in the country. Most vaccine plans will have some degree of prioritization for people with compromised immune systems. So I think you're going to see that reflected in most plans. Can I look people in the eye and give them a date of when that's going to happen? If you live in Ontario, that's not the case based on some of the communications we've had recently. All I could say is stay tuned, because we're going to have a lot more granular and helpful information probably in the days or week ahead.
So I can only imagine how challenging it is, because I know that everybody on the task force with you is really interested in moving this as quickly as possible. But we want to make sure that we do and manage these processes in a stepwise fashion, so that we don't create more chaos than is already out there in the market. So Goldy, my next question actually is to you, and that really is around the ability for private business. How can private business play a role in the vaccine rollout, or is there a role really for private business?
Well, I can link the answer to your last question. I mean, where do you think these vaccines came from? Right? They were driven by primarily private sector innovation and private sector activity. I mean, Pfizer, for example, wasn't even a part of the Operation Warp Speed that the United States had triggered from a government perspective. So I think we have to celebrate the innovation and the rapid rate at which it happened, which I understand raises questions. But as Isaac has pointed out, and I won't repeat, there's a rigorous process through which these vaccines go through before they end up in your arm. I think we should celebrate the achievement of the mRNA technology that could be used to address all kinds of other diseases we go. So the private sector has in fact been extremely active for the thing that matters the most in how do we contain this pandemic, and that's a vaccine. So I think we should acknowledge and celebrate their role, in many cases done in partnerships with academics and others and doctors and so forth. So I think that's one. I think Canadians saw back in the crisis when it began last year, we got caught relying on the integrity of supply chains that were vulnerable for a pandemic, it turned out. Who knew that you were only getting, that you could only get masks or something from one country, or that the only countries in the world that made a swab were like Italy and China? Like, how did that happen? How is it that we can't apparently make a Q-tip. So we've got to realize that innovation that needs to be brought back into Canada to some extent. Despite that, the response from the business community after the lockdown and the need for these was to retool our factories to get PPEs done. You know, we had aerospace companies like CAE that were making, you know, ventilators. Canada Goose, known for its winter garb, is making attire for Isaac and others in the hospitals. All kinds of innovation took place. We pivoted our businesses to work from home. There's a reason that the economic collapse has been limited for about 5% increase in unemployment. It could have been much worse. And a lot of that has to go with the digital infrastructure that we have in Canada, despite being as big of a country as we are. Think about all the essential services that we've just taken for granted. You know, you go to the grocery store, there's, okay, there may not be toilet paper there all the time, but groceries are there. And that's all happening because our trucking system is working, our grocery stores are working, our borders are working to making sure that these essential services are going across. Energy, you know, transportation, agriculture, all of those things. And then, of course, businesses have been very mindful of the strain this has taken on their local communities. And I think that while newspapers don't report safe landings, I'm very proud to say that businesses across this country of all sizes and scales that can help their communities have done so. They've made charitable donations, they've contributed to the healthcare emergency, and are looking to do more by being a part of the vaccine rollout, and also a subject very near and dear to the hearts of Isaac and myself, which is the need to really ramp up screening in terms of rapid tests so that we can stay on top of the variants and stay on top of the spread and contain it so that we don't end up with any more lockdowns.
So all very important, and absolutely recognizing industry for the innovation and the speed at which the innovation came, but also the collective vision. It may not be perfect, but we've done a darn good job of building and flying the plane at the same time, I would say. Isaac, part of this also must be discussions at the table for the task force here in Ontario, the balancing between the economic impact and the clinical impact and the patient outcome. How does that play out in your mind as a clinician? How difficult is that conversation to have? Oop.
I did the mute mistake. I'm glad no one saw that. So it's interesting because with the task force, there's a group effort here. And one of the members of the task force is a bioethicist. And I got to tell you, it's been fantastic working with a bioethicist. And there's an ethical framework for the task force. It's all publicly available. It's on the Ontario website under the vaccine task force section. But there is an ethical framework for which we work under. And the number one priority, the main priority, is save lives. It's preserve the health of people. It doesn't ignore other aspects of it. It doesn't ignore the economy, but health trumps everything. And I'm not going to put words in Goldy's mouth, but we've had many conversations and have collaborated together on projects, me representing healthcare and Goldy representing business and economic standpoints. And you realize, like, these aren't silos. They are so closely intertwined. And, credit where credit's due. I mean, Goldy recognized this early on. I've got to say I'm a little slower than he is, but I picked up on this a bit later on. But it's this is really manifested in the ethical framework. But of course, you can't ignore what a challenging pandemic this has been, with the tremendous health, economic, psychological impacts this pandemic has had. And I think we do ourselves a disservice by pretending there's this dichotomy. In fact, there's a false dichotomy between health and the economy. They're so closely intertwined. You need a healthy population to have a healthy economy at the end of the day.
Absolutely. Now, Goldy, I want to wind back the clock. We're almost at the 1-year anniversary of the pandemic, and one of the things that you did at the Business Council of Canada was really sound the alarm very early on about what needed to happen. So take us back then in terms of the things, the issues that you were raising, and how have we progressed as a country relative to perhaps reminding people about what needs to happen, maybe where we were 5 years ago versus now versus what we need in the future. Tell me a little bit about what you were thinking back then and where we need to go now.
Yeah, I mean, look, that's a deep question with a long answer, and I'll be as short as I can be. I mean, I think the critical thing here is that we need to be learning in real time. There's too many people who are too stressed about, about input and analysis and critiques of how we were doing to say, not now. We need to save that until it's all over. And we felt very strongly that people are dying. Like, we shouldn't be waiting to figure out whether we should be doing a better job on some of these things. I mean, you look back to a year ago, we were debating masks, we were debating borders, we were somehow feeling that Canada was a special place, that COVID would treat us differently. Clearly, that wasn't the case. And we need to learn in terms of our rapid response to what took place. We need to learn from other countries as to what they did right and what they did wrong. I am stunned at the fact that in a country that has spent more per capita than any other place in the world, Canada, very little of it actually went towards healthcare in a health emergency. And it's perhaps for that reason that we're still struggling with testing, tracking, tracing, hospital beds. I mean, we have in the world today a rapidly declining number of beds per Canadians, per 1,000 Canadians. And if you ask yourself, why are we locking down? Our original lockdown actually occurred because a number of CEOs who sit on a variety of different hospital boards phoned me on a weekend and said, Goldy, we got a call to shut the economy down. What's the reason? Oh, well, the ICU won't make it. These guys are telling me that they got 2-3 weeks and they won't be able to make it. Oh, okay, well, then we better do that. And the thinking was a lockdown would allow us some time, maybe a month or 2 months, whatever it is, to get our act together on how are we going to manage this pandemic as we go through. And instead, what we've been doing is playing whack-a-mole with this thing, up and down, and it's really taking its toll on businesses, particularly SMEs. I mean, I have to be honest, I spent more time worrying about SMEs than I have the larger businesses because they can sustain themselves. But you look at any downtown in Canada today, it is economic carnage underway. There is as if a meteor has struck. I'm facing the Parliament the buildings here, but there's nobody outside anywhere. And that has its consequences. So I think we need to learn. We need to take the time to learn. It doesn't need to wait until it's all over. It's never too late to learn it. The other thing we need to look at is, how did we get to the place where we can't manufacture vaccines? Canada had that capacity and we lost it. And so clearly there has to be an analysis of what are the actions that policymakers took that drove away the investment that would create the manufacturing capabilities of vaccines. So all of these questions I'm seeing firing out here about how disappointed Canadians are in their vaccines, those of us who live in Ottawa at least are like, well, this is Canada. This is just how we do it. We don't get number 1, we don't get number 100, we'll be like 50 or 48 or 47. It's just the way we muddle through these things. And we have to do better. We have to aspire to do better. And policy is a very big part of that. I know it's not a primary consideration for people as they worry about when do I get the vaccine, but policies affect the next time. And so I'm really hoping that we don't let ourselves off the hook by saying, well, thank God we did better than the Americans. Well, that's like telling your kid they did okay if they came home with a D because Johnny got an F. I doubt you would do that to your own children, and we shouldn't do that to our own country. We need to build back better, yes, but in order to do that, I think we need to be better and we need to do better and ask these honest questions of ourselves. Is it right that in a country that's supposed to be a country, part of our country shut down? Our own prime minister can't really go to New Brunswick today without having to isolate for 14 days. Why has BC been so late to get masks on people? Why did we leave our borders open as long as we did? All of these questions are legitimate questions. And then the flip side of it is, how do we build this economy back up? Because we can't fall so far behind that the rest of the world is ahead of us. It'll have serious consequences. So it takes what I call adult conversations in our political world to really sit down and have serious discussions about our healthcare system and also our how we're going to build our economy back.
So I can see the passion in you, Goldy.
I'm worried. It's not more than passion. I'm worried, right?
Well, as are many Canadians, and I think you're speaking to the conscious collective around those concerns. And part of your answer really answered my next question, which is really about what the pandemic has taught us about the need to support Canada's pharmaceutical sector. That's a controversial question because there's a lot to that. What happened to the sector, which was so strong so long ago with the support from Quebec in particular, Where did it go? What happens when we see people's philosophies around pharmaceutical greed? That's a word we see a lot in the mix here. Is there a bright side? Is there a balance? What can we do to restore that so that we can maintain a healthy population going forward? What does that look like, Goldy, from your perspective?
Well, I touched on it there briefly, which is, it takes capital, right? We've got to have capital to innovate, and you need to be in an attractive investment market. And Canadian pharmaceutical companies are in more cases attached to a global parent who is looking at where in the world is capital going to be most welcome, where is the talent that's available from a scientist perspective and beyond to be able to build an industry around. Canada had those things. And we drove it away through policy making ultimately. And yes, part of it is because we've been focused on drug pricing and all of that. I think Canadians, in my own opinion, and you've got 528 or so on this call here who may or may not agree with me. My sense is most Canadians have figured out a long time ago that we have not had any conversations about how to modernize our healthcare system, that we're not having the kind of political conversations necessary to build a robust medical system, not just for pandemics, but to handle the aging situation that's coming down our pike, the innovation that's going to be brought into our healthcare system. I grew up in Alberta like Isaac did. We used to hear about the card that would have all your medical information 35 years ago. It's still not here. And so we've got to have an honest conversation. I think Canadians should be demanding that of their political leaders, because policy matters. Policy matters if you want to have a robust manufacturing industry. We can build vaccines in Canada. It is happening. A company in Alberta, Providence, and another one in Ontario or in Quebec that are starting to think about this. But let's think big. Let's think about how we can bring back some of that innovative capabilities and create jobs for Canadians and create a better healthcare system for all of us.
Absolutely. So, Isaac, the scientific community, I'm sure, backs that position.
Oh yeah.
Talk a little bit about what you and your colleagues are talking about at the bench.
Yeah, I mean, we're pretty dissociated. I don't want to speak on everybody, but a lot of us are pretty dissociated from the business side of things. We really focus on research and clinical work, but certainly there are ties to industry through various channels. And I still think that this pandemic, as Goldy had mentioned, highlighted some major gaps that we had in Canada, and really our lack of ability to produce vaccines locally. And as Goldy describes, that was an issue that wasn't an issue that popped up yesterday. That was an issue that really involved years and years and years of neglect. But that's a health security threat, and we've seen it play out here. The same with our ability to not make PPE, our personal protective equipment, locally and import it. That was a health security threat. And thank God, with Goldy's help, many of the Canadian industries stepped up and are able to make it now. But there was a time during the first wave where you'd walk into a hospital and they'd say, okay, here's your mask. And that's the end of that. You could maybe get another one. Whereas before the pandemic, I mean, you put a mask on, when you go into a room when you need it, you leave the room, you throw it out. You wouldn't even think about that being a limited resource. And during the first wave, it was. And I got to tell you, it's not an easy feeling walking into work, seeing patients with an infection that you didn't even know existed 2 or 3 months ago, I guess 3 months ago. And when we started to see more cases in Canada, and you're not even sure if your hospital will be able to support you with the personal protective equipment that you're actually going to need. Like, you got to protect your essential employees, which include your frontline healthcare providers. That's not just doctors, that's nurses, physiotherapists, occupational therapists, speech language pathologists. I can't talk. Speech language pathologists. Like, if you're a frontline healthcare provider, you got to be protected. You got to be protected. And we did at the end of the day to some extent, but we know that, for example, people working in long-term care facilities, like personal support workers, were not protected, and they were, sadly, they had so many infections. It was awful to watch. So what I'm getting to this is, yes, it's a health security threat to not be able to produce this locally. We now are producing a ton of our PPE locally. Credit where credit's due. That pivot was quick, and of course, it's going to take a lot longer to support our pharmaceutical industry and our vaccine production industry. It's not just the corporations, it's also the individual scientists as well. As Goldy pointed out, there's a couple of companies that are developing vaccines locally, and now we've rejigged the plant in Montreal to help produce Novavax vaccine, which will certainly be helpful as well. But it's not just like flicking a light switch and turning it on. This really requires years and years and years of support, because it truly is a health security threat.
I couldn't agree with you more, Isaac. And just by way of personal example, my two sons are in one of those plants that pivoted from making auto manufacturing parts to PPE. So innovation is a critical part of ensuring that we secure our future from and mitigate that health risk and health security issue that you're talking about. And one of the things that that we've been talking about here at MedicAlert is the concept of what truly is the bringing together of the clinical capacity in our environment and matching it with who actually is a vulnerable person. How do we determine who a vulnerable person is, and how do we design systems and programs for early warning systems that allow us to be able to identify? It may be one thing for individuals who are in long-term care facilities to be easily identified in spite of the desecration of that system in this particular pandemic. But what about the people who are sitting at home, who aren't in a long-term care facility, but who are vulnerable individuals? Is there a vision? We are talking about the potential of creating a centralized information resource and using technology potentially to be able to help first responders make sure that in the end, we are getting information in the hands of clinicians at the greatest time of need, so that we can mitigate and lower risk in the end. I'm interested to hear your thoughts around what some central source or resource might look like from that perspective. Will that be valuable to clinicians?
Oh, yeah, I mean, short answer, yes, tremendously valuable. If there was a standardized system to be able to get an individual's healthcare information in real time, I mean, that would be just the most invaluable thing. Having said that, I'm sure we could sit down with, 30 healthcare and business leaders to map out exactly what that would look like. And I'm sure that, like anything else in business and healthcare, that would stimulate, to put it politely, debate, because
Absolutely.
I'm sure everyone has their perfect vision of what it looks like. But the concept is, of course, crucial, right? And if you look at the patchwork of how information is collected and used, you can see that there's tremendous heterogeneity, not just across the country, but like even within provinces, even within cities. I mean, I work at Toronto General Hospital. Someone could literally walk right across the street from Mount Sinai Hospital and come into our building, and it's a pain in the butt to figure out exactly what happened to that individual right across the street, like literally across the street. Now, there's some systems that are working that are trying to connect labs and blah, blah, but it's very cumbersome. It's certainly better than nothing, but I think we have significant room for improvement on that front. So any resources that would help standardize the collection of health data at an individual level and use it in a standardized manner, I would say across the country, would be just, it would be incredibly valuable to healthcare providers.
Is that
it also would save them billions and billions of dollars, right? I mean, just think about the efficiency of a system like that. The amount of hours lost digging for reports and finding, lab, I mean, this would just save so much money.
So we couldn't agree with you more. It is a highly complex idea and thought, but Goldy, to your point earlier on, we do need to future-proof. We do need to work and learn and move forward at the same time. We can't afford necessarily to wait on innovative ideas. So where are those ideas coming now from Canada's private sector? What kinds of things are you seeing, without giving away too much IP? But where can we go in terms of innovation to make things run more smoothly and effectively going forward?
Well, look, at the risk of sounding repetitive, again, policy matters, and what we're encouraging our government to be doing as we look at the budget is to think big and dream big about the possibilities of building a really robust innovative policy that allows for innovation to occur, not just in pharmaceutical, but in agriculture and in financial and, energy sector for our climate reasons. I think that that's a really key way of quote unquote building back better, is to attract capital, attract people to come and innovate here in Canada. We've shown that we can do it in the past, and we need to be able to do it in the future. But even on the ground, at a very practical level here right now, our focus is on how do we build confidence in Canadians? Because right now, Canadians have been pummeled for 10 months from being basically scared to death, literally. And you're like, okay, how do we get people to realize that once you're vaccinated and the herd immunity can kick in, and we're hopefully using rapid screening, which I've hopefully given enough plugs to today, but it's really an important component of how we're going to coexist with COVID as we go forward. We put out a program just called the Post Promise. And it's après promise en français, but it's Post Promise stands for people outside safely together. And it's kind of like a good housekeeping logo. It's a seal of approval that says these businesses are open. They're doing everything that they can to keep you safe. Please come out, go to a movie, have lunch, go for a restaurant, fly where you need to fly, take a tour, go visit and take a holiday somewhere. Those things are going to have to become a part of our life again, because I can talk to you all you like about policy and innovation, but for real people on the ground is, how do I get my immediate life back? And I think businesses are trying their best to say, we need to build confidence that we can restart and re-engage with society. Yes, there will still be some handcuffs on us in terms of masks and maybe some distancing, but in the long run, we've got to revive our economy, because I think you or Isaac, maybe both of you said it, without a healthy economy, you need a healthy population to have a healthy economy, but you also need a healthy economy, with a healthy population.
So that's really the gist of my next question, is balancing health and economics has been a challenge, and both of you who have spoken to this. And there's your Post Promise logo that supports what you were just speaking about. A very, very important initiative for us to rebuild what we know we can in Canada. As we begin to look at rolling out the vaccines, the question becomes that delicate balancing act. And Isaac, recently you've been talking a lot about we can prevent the third wave. And how does that trigger around loosening restrictions and getting people back out and involved in driving the economy of the country, but doing so in a safe way that allows us not to have to go back into the whack-a-mole that Goldy was talking about earlier, about stopping and starting and stopping and starting, which is really detrimental and difficult, both for business, but also emotionally and psychologically for individuals.
Yeah, that's a great point, because Leslie, at the end of the day, we know we have good data. We know who gets this infection, where they get this infection, and how they get this infection. And we can create policy to help prevent people from getting infected. We can create much safer work environments and indoor environments where we know the vast majority of the infection is transmitted. And, if you want to avoid lockdowns, it means you have to be quick and nimble and respond to cases in a very rapid manner. And it also means that you need to create safer indoor spaces to prevent this from happening in the first place. Create safe work environments with masking, distancing, hand sanitation, ventilation system. Create policies that help create safe workspaces. So you can't have people who have low-paying jobs who are forced to go into work because they can't afford to miss a day of work because they don't have, some element of like paid sick leave. I mean, this will, you want to prevent people from going to work sick and infecting everyone. There's a policy that can help. You don't want to have barriers to getting tested, right? Like, people might not want to get a diagnostic test or a screening test because that means they got to sit at home for 14 days. You might not be able to afford to sit at home for 14 days. So there's certainly, you can't just throw tests and expect the problem to disappear. It's got to also be coupled with smart policy to enable success. And that's how you get the economy revved up again. You create safe workplaces to protect workers, which involves policy mixed with testing, mixed with tracing, so you can see the Venn diagrams of creating safer workspaces, plus boosting public health capacity, plus boosting the knowledge of the citizens about what you can do to create safer environments indoors. And by taking that all hands on deck approach, and pardon the word, but it truly is a holistic approach, holistic in the true sense of the word, where you're looking at every piece of this puzzle and improving what you have, what you can. That's how you would create. Not only it's going to have such a ripple effect, right? Not only are you creating safer places, and you're also driving infection down in your community. So you're saving lives, you're enabling and facilitating the economy to rev forward. You're integrating data into these decisions. You're using smart policy to really facilitate a downward trajectory in cases. And you've seen other countries do this successfully. Like, some places have done this really well, some places have not done this as well. I think it's fair to say, if we learn from our collective mistakes in Canada and we learn from the collective global experience, we can really stick handle the next few months of this challenging time a lot better. And we can do so as we wait for more and more and more vaccines to roll out.
So policy is one thing. Practical application of a policy is another. So Goldy, I know when we were preparing for this Health Hour Live session, one of the things that you and I spoke about was the whole concept of, are we actually going to see changes in people's behavior that will help us to manage the economy going forward? What does that look like? You can enshrine it in policy, but practical application is really going to be critical. We know many businesses across the country have worked very, very hard to make sure that the policy is adapted in application in their environments, the restaurant sector, the small to medium businesses we were speaking about before. But what habitually do Canadians need to change in order to be successful at mitigating anything like this in future?
Well, if you're talking about it from an economic perspective, I think what we have seen through this pandemic here is the impact on businesses of all sizes has been, in many ways, it has accelerated change that was inevitable, right? Canada, again, had been somewhat comfortable in its sort of business with the Americans, and that's all we really did. To realize that there's a whole world out there now, and digitization makes it possible. So many of these stores that have had to shut down have actually found that by digitizing, they've expanded their customer base, they've expanded their business, and they may or may not reopen, or they may reopen one location and not two. So I think you're going to see some changes in that regard. It's also going to have an impact, and I'm sure there are parents and grandparents on this call thinking about their kids and work and all of that. It's a double-edged sword, right? On the one hand, your employer is sending you home saying you can work from home, and there's a risk if you're out of sight, you're out of mind. And if you can be in Mississauga, I suppose you could be in Manila. So maybe I'll hire the person in Manila. They might be more, cheaper or less maintenance required. Then the flip side is also true, right? You might be able to work from Mississauga for a company in New York or in London or in New Delhi or wherever else the case might be. So I think we'll see some changes in the workforce as well. But I will say, overall, if you call us back 5 years from now, I'm not sure things changed that much. And that's a surprise to many people. And my master's thesis was on looking at crises in the past. And what it really showed is that too many people overthink how much life's going to change in a crisis, but they don't realize the emotion of the moment. At the end of the day, human beings are human. We have social requirements. We're social creatures. We want to congregate. We want to get together. We want to fly. We want to see the world. We want to go out to lunch together. We want to go to a gala. We want to watch a movie in a movie theater, not just on our phone. So I think that as excited as people are about all the changes, my guess is 5 years down the road, you're still going with your friend to the mall to have a coffee, to go walk around for no other purpose than to go to the mall with your friend to have a coffee. And I think that is not going to change as we look down the road.
So Isaac, what's your perspective about habitual change? I don't think Goldy's wrong. It takes a long time. They used to say 21 days to change a habit. I'm not quite so sure about that in this particular case, because the things we have taken for granted prior to the pandemic are not habits. They're ingrained deeply in our psyche. So what does it mean? And what would you recommend for individuals who are looking at this from the long-term perspective?
I think when we think about what lasting change will we see, there might be some small habits. So one of the positives is I think people are going to wash their hands a lot more. I just think we're going to see more hand hygiene. I really do. You know, everywhere you go, there's those hand sanitation stations. I think that's going to be expected. The second thing is we have probably, keyword probably, softened our approach to masks. And I wouldn't say that's for 38 million people, but I wouldn't be surprised if, you know, next winter you just see a few more people than you normally would walking around with masks. Like if you think about what Canada looked like in the winter of 2018, and then you look at Canada in the winter of 2022, you'll probably see more masks in 2022 than you did in 2018. Just a thought. You know, it's interesting because we sort of have a little bit of precedent for this. Like we had SARS in Toronto in 2001. Obviously, it's a completely different scenario, and obviously SARS was bad, but I mean, it wasn't like this. But there were some short-term changes in Toronto following SARS. There were actually, they overhauled the public health the Ontario Public Health after SARS. And at a time, it was a very, very strong institution after SARS. Like they really rebuilt it. But, you know, you don't have a huge pandemic for about, 20 years or so. And, you have budget cuts and funding cuts and then you whittled away at the power of what we used to be a very powerful and strong public health institution because people forgot and it was deprioritized. And now you out of the blue, we're met with a true global health crisis, and the institutions that should be leading the way and leading the charge and be strong and filled with the top minds are still there, and they're good, but they used to be great. And like, I'm not knocking Ontario's public health. I'm just saying if you look at the funding and the brains that were there a while ago, there was some incredible talent there. And I think talent moves on. If you don't, you've got to keep your foot on the gas, is what I'm trying to say. You've got to continue to prioritize it and fund it, attract your top-notch talent, maintain top-notch talent, and then build it within. But you don't really have it to that same extent now. So, I don't want to repeat cycles of this again. I think it's always good to have strong public health, and I hope we will certainly see a boost in federal and provincial and municipal public health spending. I think we're going to see that as a big priority. But the question is, 5 years from now, is that going to start to be dwindling, and will we be prepared for the next one? I don't know.
That's a great segue to my last question, which I will pose to you, Goldy. Is it time to overhaul our single payer system in this country?
I think it's not only time. I think most Canadians know it's happening. It's been happening all around us for the last 2 decades. And so it's naive to think that we have a single payer system. There's all kinds of things that Canadians know, depending on which side of the river I am here. Right here in Ottawa, I can go to Hull and get a different service than I can here. So as I said earlier, I think Canadians are a very smart group of people. They're more than prepared to have an adult conversation about modernizing our healthcare system, but no political party has had the courage to raise it for the last 2 decades. And as a result, we get distracted by all kinds of other things, but something as core to our well-being as our healthcare system is not being discussed. And the solution is almost always, we need more money. There's been a lot of money going into the system. There's a lot of money actually, despite what I said earlier, did go into healthcare in this pandemic. A lot of it didn't even get spent. We still have very poor bed ratios. We still have, lack of technology being employed in our healthcare system. So don't ask me, ask your participants. I think they want this more than anybody else. That says it's high time that we modernize our healthcare system. And I think the Canadian public would reward the political leader or political party that goes out there boldly to say, here's how I envision the future of healthcare. No one's done it in the last 2 decades. Maybe somebody will soon.
So it's part of our psyche for sure. And it's something we need to continue to discuss and talk about. We won't solve it here in the last 3 minutes of this version of Health Hour Live. But if I could wrap up by asking each of you to leave us with one key thought that you would really want our panelists to take away. So Goldy, let me begin with you.
This too shall pass.
Well said, well said. And Isaac, from your perspective?
I wish I could go first because I was going to say almost the same thing. I was just going to say it's going to get better. It really, truly is going to get better. We may have a little wave. We may have a wavelet. We may have a full-blown wave. It's unclear. But even if we have that, it's still going to get better and better and better. And as we move through 2021, things truly will improve.
Thank you, Goldy, President and CEO of the Business Council of Canada, and Dr. Isaac Bogoch, one of our treasures in infectious disease here in Canada. Thank you so much for joining us today. The conversation, I'm sure, will continue, and maybe we'll bring you back when things do get better, and we can do an assessment at the end of all of this. So thank you so much. Thank you to our audience for joining us today. And take care, everybody, and stay well. Thank you so much.
Thanks for having me.
Thank you. All the best, everybody. Stay safe.